In our youth, being limber and pain-free is something we take for granted. Participating in sports and completing everyday mundane tasks is simply the norm. But as we get older, it can become more difficult to do the things we used to do. In some cases, the pain caused by the simplest movement can be downright debilitating, particularly when we enter our 40s. The cause? For many, it stems from degenerative disc disease or disc herniations. These very common conditions happen over time as our bodies begin to age.
Degenerative disc disease is not really a disease per se. For most people, it represents totally normal age-related degeneration of the spine. Now, as the discs age, they start to lose their fluid and their ability to be good shock absorbers. For some people, especially younger people, middle-aged people, this can result in some chronic back pain. Now, as the disc starts to degenerate, it loses height and bone spurs can form, which can actually pinch the nerves that go down your legs. So for some people, you can actually develop chronic back pain and leg pain from degenerative disc disease.
A lumbar disc herniation is a pretty common problem that can be brought on by something as simple as an awkward twist or a lifting injury. It involves when a small piece of the central soft part of your disc pushes through its more tough exterior. That piece of disc then goes on to contact the nerves in your spinal canal. It can result in severe pain, numbness, and tingling that shoots down your buttock, thigh, and leg.
When the pain becomes so severe, surgery is typically a patient's best option. Using the most sophisticated diagnostic equipment helps doctors positively identify when surgery is necessary. The good news is that spine surgery is now so advanced, minimally invasive procedures such as the lumbar microdiscectomy have up to a 95% success rate. Dr. Raphael Levin is proficient at this procedure and explains how it's performed.
As the name suggests, a lumbar microdiscectomy is a minimally invasive surgical procedure designed to alleviate the painful pressure on a nerve which is being pinched by the underlying disc herniation. The procedure is typically done under general anesthesia in an outpatient setting, allowing the patient to go home within a few hours after the operation. The surgery is done through a tiny incision just large enough to allow specialized instrument to do the job. This is enabled by use of a microscope which allows for magnification and illumination of the nerve root, which is being directly visualized as the pressure is being taken off the nerve root.
Well, I had pain in actually two spots, one being the lower back on the right side and then my right leg on the back of the thigh, causing it to be very difficult to sit for long periods of time, which I do at work, and at the same time when I would lay down. So it was making it very difficult to basically just function through my regular day. I received a microdiscectomy, and a few weeks after the surgery I was completely back to normal. I did have a few weeks of physical rehab, and now I'm able to sit all day at my job, which is long periods of time, and I'm able to lay all night in bed and wake up in the morning without any pain.
Pain of any kind can be life-altering, but it doesn't have to be that way. At our fingertips are some of the most advanced surgical options mankind has ever seen, helping us maintain the highest quality of life possible.
We believe that surgery is always the last resort, but when it's required, the patient needs to be very involved in the decision-making and understanding as to what all the options really are. We believe that an educated patient is to our mutual benefit. So providing great patient education, treatment, and support is our mission statement, starting with the first phone call to this practice and continuing throughout the patient's entire experience with us. I truly believe that here at Comprehensive Spine Care, we've succeeded in carrying out our mission and have earned the respect of our peers and colleagues in doing so.
The surgeons at Comprehensive Spine Care have only one goal in mind: restoring the health of your spine. Each and every patient is carefully assessed and diagnosed to make sure the right treatment protocol is carried out.
The procedures that are routinely performed in our practice can be divided into two categories. The first category involves decompression procedures that are designed to alleviate painful pressure on nerves, resulting in pain radiating down one's arm as a result of pinched nerves in the neck, or pinched nerves in the lower back that result in severe leg pain. The other category of procedures that are being done routinely are stabilization procedures designed for patients with severe back pain or severe neck pain, and these procedures can also be done for situations where there is malalignment of the spine and one needs to improve their alignment to improve the patient's function.
The bottom line is, you don't have to live with debilitating pain and you don't have to be anxious about surgery. Depending on the condition being treated, the doctors here will recommend one of these less invasive options that are proven to be maximally effective.
Before making a decision to pursue surgery, most patients should realize that the majority of spine conditions are treatable without an operation. If you've gone through and tried all of your alternative conservative treatment options and you still remain unhappy with your level of symptoms, then surgery may be right for you. Spine surgery is very successful at alleviating the symptoms caused by nerves that are being pinched, with success rates that approach 90%.
I had a decompression and spinal fusion, and it's been almost 20 months, and I'm completely back to my normal activities, teaching yoga again. I did a Tough Mudder race, which is a 12-mile race, in May, and 8 months after the surgery, I was back to running 5Ks. So I couldn't be happier. Pain-free.
I would refer a friend or a colleague to the Comprehensive Spine Care Group. And one of the things that you should know is that you're going to have a few questions along the way, and the staff and the doctors are excellent in explaining everything you need to know in order to get yourself back on track and live a normal life again.
When you've tried everything and you're still in pain, turn to the experts at Comprehensive Spine Care. Your quality of life is their life's work. To schedule a consultation with one of their doctors, call the number on your screen.